Good afternoon, and today I have a pleasure of interviewing my friend and partner in Manhattan office, Dr. Zaruy Chopuryan. She is pre-aging aesthetic medicine. Good afternoon, Zara.
Hi, good afternoon. Thank you so much for the invitation, Marina. I'm so happy to be here and to participate in this podcast.
And in our conversation, we're going to discuss the topic what become so close to my practice and to a lot of my patients. We're going to talk about Ozempic face. That's a phenomena. I learned this term really recently, but a lot of my patients taking weight loss medications, and I see definitive changes on the face. And a lot of people, summer is coming. I'm sure I'm going to see it on the body as well, related to rapid muscle loss and fat loss with it. So, I invite the expert, and we're going to talk about how we can rejuvenate that strategically, like moving beyond quick fix and explore how weight loss impact facial structure, muscle tone, and overall health, and learn how we can do the long-term prevention about aging, how to support the face from within, and combine with the different aesthetic treatment what actually on the market, and not only on the market, but actually in the office of Dr. Chopuryan. But we're also going to do it through the scientific approach, through the function, biology, and wellness. So I have a pleasure of introducing Dr. Chopuryan, and we actually graduated from the same medical school in Russia, almost in the same time. And yes, we become friends and colleagues here in the United States, but our history have so many years of shared history. But after graduating from medical school, originally, Dr. Chopuryan is from Yerevan, Armenia. She moved to St. Petersburg, Russia for her medical education. And then she worked for some years in St. Petersburg, Russia, and then moved to Spain. And in Spain, she has education in aesthetic medicine and 15 years of experience. And now with all this experience and expertise, she moved to United States, to New York, and start all over again and become a medical doctor. And my huge respect and admiration and for that courage and for perseverance to go through that. And she's able to bring this expertise to us and have her license and practice in the United States. And she is doctor of aesthetic medicine, pre-aging aesthetic medicine here, but she's also have a hospital experience, and she worked as a doctor of palliative medicine in a hospital in New York. So with that, like diverse of experience, seeing so many cases, and actually to be on a edge, or really on a cusp of all the innovation aesthetic medicine offer right now, I'm going to ask you general question. What am I seeing in my practice with all these patients who successfully take GLP-1 medication? What is it? Ozempic face. And why, for my taste, they all look older than before taking that medication?
Yeah. Oh, very nice question. So thank you very much for very nice presentation too, Marina. I was listening. It is like whole story history book. Yeah. So thank you. So about Ozempic faces. Let's give a very short presentation. What does it mean, Ozempic? What is it, Ozempic, right? So Ozempic is a drug that has semaglutide, that is GLP-1 receptor antagonist. And what does it do? It mimics our own hormones, and we are not feeling so hungry, right? So, and plus it slows down the emptiness, the process of emptiness of our stomach from the food that we just ingested, and plus it regulates the sugar. So it's really reduces appetite. So it's really very, very good treatment drug that it's helpful for millions and millions of people to get healthier. In case if they are unable to lose weight by like normal, let's say, classic way, right? Exercising, diets, there can be a lot of obstacles. So at least we have this medication that can help them. And we are talking usually about how good is it for heart, how good is it for liver, and no doubt about it. But very, very rarely we're talking about skin. And skin is the largest organ of our body. How, in this case, not good Ozempic is for our skin. And I would like to say the problem is, like in 99%, is not in Ozempic, okay, but is in weight loss. So the patients who is on Ozempic, they are losing usually their weight very fast, and there is the problem. So we see Ozempic face, but you are absolutely right. We could say that we see Ozempic body too. We just don't see it because people usually covers it up. So what happens with the Ozempic? Losing weight very, very fast. Well, first thing that we are losing is actually muscles and fat then. And the fat is more visible because we have two types of fats, right? A deep fat on the face and superficial fat on the face. Let's talk about face so far. So what does it mean deep fat and what does it mean superficial fat? Deep fat is the fat that is structural support, okay, for tendons, for ligaments, for muscles. And superficial fat is mostly for appearance and the quality of skin. But we should talk about Ozempic face, not just a unilayer. It's a multi-layer problem. And if we are approaching it, or we are understanding that it's multi-layer and approaching it correctly, then we can success. But we have to know that Ozempic face is not just fat. Okay, so if we're going from superficial to the deeper layers, we can see that skin problems also there. Why? Because skin doesn't have time to shrink, doesn't have time to adapt, especially with the age, right? When we have young people, their skin still have this kind of this quality to adapt fast.
Elasticity,
Its
yes.
elasticity is there, exactly. The collagen is there. They still don't have the decrease of collagen production. So adaptation is better, but there we are going deeper. We have the deep fat loss, and then we can see these kind of changes in older patients and as well as in younger patients. It's a hollowness.
Hollowness.
Hollowness, why? Because the loss of deep fat, the loss of the structural support gives, we can see it as an irregularities, shadowing and hollowness. So in older patients, we can see the same thing, the two things at the same time. We can see like the loss of this smoothness of the face, and interesting, so it's kind of less, let's say, face on upper face, but we can see heaviness in lower face. Why? Because there is a loss of structural support, right? So in young patient, maybe we cannot see so much it's because still collagen is good and skin can adapt fast, but in older patients we cannot see it. So there is not just skin changes, there is not just fat changes, there is also muscle changes, because muscles has fat too. We are losing that fat too between muscles layers, right? So lean muscle loss is also observed when we are losing very fast the weight. And ligament support, it's very important. And ligaments lose their support because fat is gone. So we can say, okay, bone maybe it's not suffering too much, still suffering because of estrogen. Estrogen is going down because fat is going down, but still not too much, not too much. But losing the ligament support, bone starts to be not so strong either.
Yeah, this is, it's like I really love this treatment because over the course of my dental sleep medicine career, at certain point, I would say 10 years ago, bariatric surgery was so much in favor. And now, 10 years after, I see people who had bariatric surgery gain weight again. So, GLP-1 for me personally bring a lot of hope. We don't know long-term effect, but at least it's the idea of the person can be on continuous loss, like, maybe, have a loss of weight, but then support maintaining of the permanent weight. But I understand what you have to be strategic with the weight loss. You want to feel younger, look younger, or at least healthier. That's usually they go hand in hand. That appearance, what we want to bring to the world. So, cosmetic treatment we're going to talk about, or strategic approach to GLP-1 medication management. And my first question to you: what can be done if we want to approach it strategically? But question not only about the face, because yes, wonderful, you can put all the clothes on, but now it's getting nice outside and you want to be proud of your body as well, because body image is a body image, important for all of us. So if you can talk about what should be done in conjunction to start with the decision to start GLP-1?
Yeah, a very, very nice question, actually, because first of all, of course, this weight loss should be under very strict control, right? Very close control by the healthcare provider. So why? Because it's very important to start in a good, more or less good health, and not to lose maybe too much since the beginning. So the weight loss should be controlled. Okay, I understand people. They were so long time overweight, that maybe obese. They want to see themselves very slim, very fast. But we should understand this is a whole body, and we should think about how the whole body, all organs are going to react to this loss of proteins, nutritional deficiency, right? Not very good approach for the skincare either. So I would say that before starting, we should be absolutely sure that patient has very good nutritional support. Of course, exercising, hygiene, good care. And if we are talking about skin in general, and all these things that I just mentioned, they are now like a priori should be there, like protein should be there. Then we can talk about, okay, let's take care of skin, face, body before it's late. Because it's always much more easier to prevent than to treat, right?
Of course.
Easier, faster, much more natural results, and cheaper.
But what can be done? Like, what can you offer? I'm
Okay.
sure when we have GLP-1, I'm sure in a aesthetic or pre-aging medicine, we have a treatment what can help us with the result. They usually
Definitely. Yes. Yeah, definitely. So when I have patients who comes to me and they said, okay, I just started, I started 1 month ago, or I'm so happy, but I want to see myself happy in 3-4 months too. Because at the beginning, usually they start because they want to lose weight. It's about the health. But they go, as you said, very parallel to each other, alongside. Why? Because when I'm healthier, I want to see myself nicer too.
Of course.
Right. So first, let's take care of skin. Let's take care of skin and deep structures. So PRP, right? So I would say radiofrequency, we can start since the beginning. Why? Because it will help not just with the improvement of skin quality, that it's there definitely, but also it can improve the collagen production, or at least to maintain the collagen production. Because at the beginning, since the beginning, we seen that patients protein deficiency. So with the collagen, improvement of collagen production, adding proteins, adding peptides, for example, injections, we can help at least the skin not to lose these proteins and to maintain on the shape. And then we are talking about deeper layers. We can talk about maybe Sculptra, maybe Radius, not too much. We are talking about prevention. Okay, we are not waiting very fast results. It's going to be one injection now, another one maybe in 4 months. Okay, but we can prevent all this hollowness, heaviness, older looking faces. And the same thing actually we can do with the body too. Who said that we cannot do radiofrequency to the body, especially to the strategic areas like our hands, abdomen, inner side of the thigh? Yes, knees.
Oh,
Don't
yeah.
forget about knees. Yeah,
They get wrinkled.
absolutely. So radiofrequency, some kind of peptides injections at the beginning, and then if there is a need, injections of biostimulators like Sculptra, Radius. Everything should be very, very individualized.
No, but tell me, when people start losing that, why they cannot just focus on, treatment what we all love,
Yeah.
Botox and fillers. I understand those wrinkles form and people want to, okay, let's do Botox then, fat disappear, then the wrinkles become,
More and more, yeah,
visible.
visible.
Yes.
It's like masking the problem. We are not really resolving the problem. And how much fillers you can use, it makes the face puffy, heavier, and at the end, older and not natural, right? So Botox, for example, if we're talking about Botox, as I said, muscle changes too, right? We are losing lean mass. So what does it mean? That muscles are become I couldn't say that very, very weak, but a little bit weaker for sure. So we are adding more Botox, expecting that we are going to look younger, but no, we are not reacting as we should react. They are not, I would say, they are not responding by the usual way that we
We
see,
used to.
that we used to see it. Yeah, we used to. So what I would recommend on that cases, so first of all, give a little bit support to these muscles too. We are still talking about peptides, we are still talking about the collagen, and then you can use Botox. Small amount of fillers, good. Nobody tells you that we don't need to use fillers in our patients. Definitely, on some of them, we have to do it because it's too late. They are not responding to biostimulators, or they don't want to wait now. But it shouldn't be the first approach, first of all, and the amount should be very precise in very strategic points and right amount. So we should be open, let's say like this, to everything that we can use, but thinking first, you should cover the base. And base is the structure, supporting structure, and then go from there.
No, I'm sure that, the consultation when you're getting ready for your GLP-1 journey, consultation with the experienced specialist on pre-aging medicine, like Dr. Chopuryan, that would be a great idea. And we are having event in Manhattan. I'm gonna talk about that. We're already talking about that on social media. People, our audience, you can RSVP, and we would be very happy to see you on the event. And then you can schedule the consultation with Dr. Chopuryan. And I have a last question. Kind of like I want you to summarize the strategy, what persons should do when they starting their GLP-1 journey, Ozempic, Zara, there are a lot of medication now. Tell us, how does muscle tone, oral posture, breathing pattern influence facial aging, and what should be the strategy step by step to prevent Ozempic face and body?
So, mouth. I would say that in general, mouth breathers, they have this kind of changes in lower face, right? Because of open mouth during the whole life, that with the weight loss, I noticed it that aging, you can see it much more visible, faster in that kind of patients. Why? Because muscles in lower face, they already have that muscles weaker. So because of the open mouth, because of bad posture of the tongue in the mouth. So with weight loss, we can see these patients look older, faster, and more even more older than in patients who is nose breathers. So definitely I'm leaving them to you, Marina, to take care of the
Of that
right
habit.
form of breath. Yeah. So, and how I would recommend to approach, first of all, lifestyle, right? Right food hygiene, I mean nutrition, enough proteins, take care of skin, at least at the beginning. It will be just the skin at least. So it can be radiofrequency, peptides, injections, PRP, everything that can stimulate collagen. Okay, to help your skin, to prepare your skin. And then in 1 month, 2 months, you have to go to see the specialist again, most likely for the biostimulator injection, like sculpture, like radius, hydroxyapatite calcium, let's say like this, not talk about the brand names like PLLA and hydroxyapatite calcium, because they stimulate the collagen from the deeper layers. And that all of this should be always alongside with some kind of devices to help still this collagen to maintain. And we're again talking about radiofrequency. There are a couple of machines that really worth to try, and one of them, it's not because I have it, but I really love it. It's
And I love it
Everest.
too.
It's Everest Bible Numer. It's a painless, no downtime, and really you can see results. Okay, so then continue just seeing. It's if there is a need for a little bit filler, definitely it can be done and should be done, but not as a first treatment, because it will be absolutely wrong approach. You will still continue losing weight. The patient will still continue without the collagen production, without the support, and then ligament support, and then hollowing, and then heaviness, more heaviness because of added volume of hyaluronic acid. So it's a wrong way to treat it.
Thank you very much, doctor. And our interview, we're talking about pre-aging medicine. It's not only for females, it's for all genders who using GLP-1. So men,
Definitely.
longevity, it's a very hot topic for men, and, radio frequency treatment that produced the great results with the stimulation of collagen just to keep the skin looking
Absolutely.
healthier.
And we can, as you said, we can use it in strategic areas of the body as well. Abdomen, inner side of our arms, inner side of our thighs, knees. And I would say that this term Ozempic face, we can use it for any patient who lose weight very fast. Usually it's all through medication or through surgery. So when skin doesn't have time and body in general doesn't have time to adapt. So for that patient, I would really recommend to go to see the specialist as soon as possible.
Thank you. And we're looking forward to see people who want that consultation on our event on April 22nd in our Manhattan office at 5 p.m. Thank you,
Yes,
doctor.
please. Thank you very much, and you're invited, guys. Thank you.